Good morning and thank you for joining us again. Teresa is not here today and continues to work from home. I'll report our local numbers. We now have a total of 11,230 cases, an increase of 173 cases from yesterday. 15 cases are related to outbreak, 12 are close contacts of confirmed case, 2 are community acquired, 144 cases are still being investigated. 2,519 cases are still active, 8,440 cases have been resolved. We now have a total of 271 deaths, an increase of 15 deaths that was reported yesterday. 9 are from the community, a man in his 50s, 2 men and a woman in their 60s, 3 women and a man in their 70s, a woman in her 80s. 6 people are from the long-term care home and retirement home, a man in his 60s, a man in his 70s, a man in his 80s, 3 women in their 90s. I want to express my condolences to the family, and my thoughts and prayers are with them in this difficult time. At present, there are 121 cases that are currently hospitalized, and 17 of them are currently in ICU. There are 53 active outbreaks, 20 long-term care home and retirement home. 1 outbreak was presented yesterday. 27 workplaces, 4 hospital outbreaks, 2 community outbreak. We continue to see day-to-day fluctuations, but overall we can see the 7-day moving average is stabilizing. We will continue to report most up-to-date data with the community to keep everyone aware, but please note that our epidemiological summary every Friday is a much better way to understand the COVID-19 spread in the region. As always, please continue to follow the public health measures to keep everyone safe around you and keep our community safe. Thank you.
We'll now take questions from the media. We'll start with the Windsor Star.
Morning, Dr. Ahmed. Since the numbers being reported by the lab are fluctuating so significantly, do you think it's still valuable to report the daily case counts to the community, considering the Friday summaries are the most accurate information?
Well, again, it really depends on the interest of the community. We realized earlier on in the pandemic that the community wants to be aware of every day what happens and how each of these numbers change. So we took that initiative to ensure that we are acting as the community interest is, with the caveat that please note that sometimes these fluctuations, it's better captured when we are looking at a 7-day moving average or an overall picture of the community. Overall, I can still say that if you look at our 7-day moving average, we are stabilizing, and there are, despite these fluctuations, overall our case counts in the region tends to appear to stabilize. I would definitely say that similar trend is currently being observed in the province too. Our provincial case counts were down yesterday too, and hoping that maybe this is a trigger, this is the sign that things will continue to improve from this point onwards.
And did you communicate at all with the lab that's sending back the results to make sure to see how many tests we're getting back? Is there a difference in that day to day that's causing such a significant fluctuation, or are you still speculating at this point?
Yeah, it's hard to say at this time because in the data that I'm reporting, 44% of the cases that I reported today was from January 16th, and then 30% of the cases that I reported today is from January 15th, and 10% of the cases that I reported were tested on January 17th. So still we have a pretty good mix of when these tests are conducted. And again, we can't say that people who are going into test today, are they all sick? It could possibly be. The other day there could be more, non-COVID people going into the lab. So really there is no way to figure that out. But you know, and the data is the data. So we can't really say or change what the data tell us. But we also have to understand that how we are interpreting the data. So I think at this point, it is still fairly recent numbers. So all the numbers that we are seeing today is from the tests that were conducted on January 15th, 16th, and 17th.
Okay, thank you.
Any questions from AM 800?
Dr. Allen, just wanted a clarification. You said 15 deaths, but the website shows 16. Which one is it?
I have 15, so I will make sure that my communication team double check and make sure that we can fix that. I have a total death rate as 271, so I'm not sure if that's the number that and Mark is nodding. That means that's the number. So maybe just the calculation that how we have done. So we'll get to it. Rob, thanks for letting us know.
Okay, just want to double check there. And then current workplace outbreaks, those continue to rise almost daily. Just your thoughts on that, concerns?
Well, obviously, I think that has been the concern. The more workplaces that stays open, there are likely chances for people to come in contact with someone who is COVID positive. And I think some of these trends are the ongoing trend when people basically had some of these like contracted virus around the holiday season and progressing to spread or continuing to spread it to other people in the last couple of weeks. So it is a concern, and that's why it is important that these workplaces should continue to look at their policies and how people are following that. For many places, we do recommend that they should have some kind of an audit mechanism in place, so the employers are aware of the compliance of all these public health measures among their employees. So we'll continue to learn more and share more of that information with these specific businesses. But you're right, the numbers are increasing significantly.
And sorry, one quick one here. You mentioned the holidays. Are we still seeing numbers come in from the holidays, or are we past that point?
Well, not necessarily for the disease that was acquired during the holidays. I think that we have seen those numbers, but you have to remember, anyone who acquired that disease, they probably passed it on to someone else too. And then those people continue to either keep the virus or pass it on to another people. So it's a cycle, it's a chain of event. So even let's say if whatever happened during the holiday time and then everyone just stayed home and didn't do anything, then probably you should see a sudden drop in the number of cases. But you have to remember, some of these people continue to be outside or continue to be at workplace or continue to be in places where they are potentially putting others at risk. So it's not necessarily just the sheer number of people who were out and about during the holidays, but the ongoing spread from those cases will continue to show up at this time. But as we have noticed, that the numbers are starting to slow down, and we hope that that trend continue.
Thank you.
Any questions from CTV?
Yes, good morning. Just expanding on a question that I asked yesterday, are you aware of anyone in Windsor, Essex who has died after getting a COVID-19 vaccine? And what would be the process if this had happened?
So vaccine safety is a big topic in Canada, as we know that there are a number of reporting requirements that is there to ensure that the safety of these vaccines are monitored very closely at the local level, at the provincial level, and the federal level. So anytime if there is any kind of vaccine related adverse event happen, it is reported to the health unit. So we are aware of a death, and right now it's being investigated at this time. Due to the personal and confidential clinical nature of all of those details, I can't share the outcome of what this investigation looks like, but we are aware of a death in the retirement home that you're referring to.
And I guess, is there any point where you would be able to share any more information?
Of course, as I said, the vaccine safety is a critical issue, and there are a number of things that are happening right now, including an investigation to figure out the chain of events, the possibility of what led to the death. And all of those details, when it becomes available and we are able to share, we will definitely share that information. I don't have a timeline, but all I can tell you is that this is an active investigation, and all of that work is happening right now.
Okay, thank you.
Any questions from CBC?
Hi, good morning, Dr. Ahmed. I wanted to ask about delays with the Pfizer vaccine, the supply of that coming to Canada. Do you have a sense of how and if that will affect the rollout in our region?
Well, we did had some discussions with the Premier's office and the general with respect to how the vaccine rollout will impact our community, and we were given some projections in terms of what vaccines we can expect to see despite the shortages. Based on that, as the number one priority identified by the Premier, by everyone, is to vaccinate the long-term care home and retirement home staff, resident, and essential caregivers. So that will continue to be the top priority at this time, despite the delay. And anyone who has received their first dose, if they're eligible to receive their second dose, they will continue on with that. Based on the projection, we should be able to achieve that target, and we will continue to prioritize and reprioritize to make sure that our long-term care home, retirement home staff, residents, essential caregivers are given the first priority with any vaccine that comes in our region.
Thank you. And I just wanted to follow up on the previous question. So was it a resident of a retirement home that died after receiving the vaccine?
That is correct.
Thank you.
Any questions from Blackburn?
Yes, good morning. Regarding testing and test results, I know you usually report this on Fridays, but do you have any idea of how many people were tested yesterday, or if that number continues to go down?
Well, we have seen a little bit decline in terms of the daily tests that were conducted. But again, as you rightly identified, that at the end of the week, we have those numbers, confirmed numbers from the lab directly. Some of these are partial numbers. We have heard from the regional hospital as well that they have noticed a slowdown, a little bit of slowdown in the number of people going for the testing. That could mean a good thing because maybe people are not symptomatic, that's why they're not going to the assessment center, or it could be some other factor that are preventing them from going to the assessment center. So our message has always been clear: if you have symptoms of COVID, if you think that you need a test, please go and get tested. There are 2 assessment centers open even within the 2 campus of Windsor Regional Hospital, so there is sufficient capacity at the assessment center to get the test done. And so we strongly encourage anyone who have any of these symptoms should go and get tested. But I would be in a much better position to tell you the specific number of tests that we have seen over the week time. But last week, as I reported, I think we have seen close to 11,000 tests in a week time, with a slight drop in the percent positivity. So if the trend continues, we'll be in a better position to say if there was a decline in the number of tests, or how, and irrespective of what the decline is, what the percent positivity of these test results are.
And do you know if there was, if the lab that was supposed to start processing tests yesterday, did that start go smoothly? Is that up and running now?
I won't be able to comment on that. I am aware that they are to start that, and they are doing it, but I think specifically for their operations, I can't comment.
Thank you.
Any additional questions from the Windsor Star?
I suppose, Doctor, I know the death of the long-term or the retirement home resident after the COVID-19 vaccine is concerning and is under investigation, but should that compromise people's confidence in the vaccine?
I don't think so. I think there are a number of things that we need to consider every time when we're talking about any kind of adverse events following the immunization, and that's why these investigations are important. Sometimes it's just the timing of one event versus the other. So it's you can talk about correlation, that something was to happen and then somebody did something, and then you're trying to make sense if this triggered that, or is it completely isolated events and then happens to be at the same time. So the investigation would definitely help us understand, and as a clinician, as a public health professional, I would definitely be more focused on understanding what caused it, and if there's anything that we need to be aware of as we continue to roll out the vaccine. So far, based on the international data, the vaccines continues to be safe. And there are some clear indications in terms of the reactions that people can expect with severe allergies. So that would continue to be an investigation that we'll have to see. But again, a lot of the personal health information also goes into play, which I cannot share. But as I said, if that would become a concern, we will definitely be the first one to talk about it, and we'll continue to share that information. But at this time, based on all the data that we have, vaccine continue to be the safe and most effective ways to prevent from COVID.
Great, thank you.
Any additional questions from AM 800?
Dr. Ahmed, I'm not sure if I missed this, but who's spearheading the investigation?
So I don't know, there are multiple agencies involved. So obviously public health, the home, the coroner's office, and the province have an interest in that too. And then obviously when all of that data is collected, it has to be shared with the respective agencies and at provincial and federal level as well.
Are you hoping, I'm not sure if goal is the right word to use here, but the investigation will show if the vaccine was a factor in the death? Is that what the focus of the investigation is?
Well, I think the focus of the investigation is on the death right now. And then every possible issues will be considered. And again, I don't want to say too much because obviously there are issues that are beyond the vaccine in many cases. So I don't want people to think that all of this investigation is linked only because of the vaccine. So I just want to be very clear. This is not just necessarily we're concerned about the vaccine. There are other factors, health history, number of issues that needs to be taken into consideration before we can even say that. So please don't get me wrong here. This investigation, this has right now at this point, not directly tied to the vaccine only.
Okay, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, I had one quick question. Dr. Ahmed, do you think that the plateauing or the decline that we're seeing now in case counts has anything to do with the closure of schools?
Good question. I can't say that because our school systems have been closed for some time. So I don't think that it is. I can link it back to anything related to school at this time.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone.
Thank you.